You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about getting a brand new upper and lower set of teeth that don't come out in just one day. With us, we have an expert on the topic. He's in Brooklyn, Dr. Moise Nawlo. Dr. Nawlo, welcome to the program.
Thank you for having me here, Randy. It's a pleasure.
Thanks. Now, I know you brought some photos, so we'll get to those. But for people that don't know your practice, like who's the typical dental implant patient?
I don't have a typical patient, Randy. I have two kind of group that usually come to my office. One group is people who have denture, upper or lower. They're not happy with their denture because they're loose, they can't smile, they can't function properly. And I have another group of patients who comes in who are heading toward denture. They have loose teeth, bad breath, bleeding gum, and they want to have something about it. The dentist told them that they have to take out their teeth and they can't stand the fact that they're going to go into denture.
So they go to you because they don't want a denture?
Yeah.
Now, your center that you have there in New York, I guess correct me if I'm wrong, by the way. Oh. How dental implants are typically done is you go to one place that, like an imaging center, you get the CT, another place where they do the surgery, and then another place where they put the teeth on top, and then one more place where they maintain them. At your office, you do it all right there.
Everything.
Is that why you do it so fast?
That's why we do it so fast, but also we have the experience to do this kind of cases. We have everything that's done in one day because we have digital imaging. We have the technician available at the day of the surgery. That's helped me.
The person making the teeth they're all right there.
Yeah, he's during the surgery. So if after the patient wake up, we ask them, how do you like the smile? Is there anything you want to change? And we are there. The technician is there. We could just go in the back in the lab and change it and put it back into the mouth.
Now, are there a lot of people in New York or especially Brooklyn that are wearing an upper or lower denture or headed to dentures? I mean, is it a big problem? Is that, I guess, what I'm saying?
Well, in Brooklyn, we have the Barclays Center. I could probably fill it with 10 times with the people who are having denture, full upper or full lower, or with people who are missing teeth, 6 or more teeth, or are heading toward denture. There are thousands of people who have full denture in New York. Actually, there are, it depends on which study you look at in the United States, there are 40+ million of people who are having denture.
Okay, and you say no more dentures. I mean, you think that's a future of dentistry? Like everybody will have teeth that are attached to implants?
Definitely, because with implant, I could place a couple of implants and I could make the teeth, permanent set of teeth, Randy, that looks like your normal teeth, and I could attach them to those implants and they look natural and beautiful and they could chew their food properly and beautifully.
I'm going to put you on the spot here. You said, of course, you have to have an opening in your schedule and all of those things. But somebody watching this, and if you had an opening tomorrow, and they had the worst teeth, really bad teeth and gums, or they're wearing a denture, they can go meet you tomorrow, and the following day, again, if you're scheduled, they can get their upper and lower teeth that don't come out.
I could do that.
Really?
I could do that.
Has that ever happened? You could do this in 2 visits?
I do it all the time. This is what we do every day in our office. People comes into our office, they have all sorts of problems, and it depends if they want to do it as soon as possible. We could just accommodate them and do it.
And you also have lasers.
I do.
That you use.
Yeah.
Because some people, you say you save their teeth. They think they need dentures, but you save their teeth. Could you talk about that for just about a couple seconds?
Sometimes I get people who have like loose teeth or bleeding gum, and they tell me they want to do their implants. And most of the time we try to save their teeth because teeth are always much better than implants. So we have this technology that we have been doing it in our office, laser treatment, where you don't have to, like the old way, where the patient has to be going to a dentist, they cut their gum, and they do it the very aggressive way. By us here, we just go with the laser lights all around their teeth,
nice.
And it targets those bugs and kills the bad bacteria and the bad tissue, and the results are like amazing.
Are good.
I saved a lot of people's teeth because of this.
That's nice. Now, as far as dental implants and getting new teeth, how old can you be to get this done?
You could be 100 years old to do this.
100? What's your oldest patient?
I had a 95-year-old lady.
Really? Why would a 95-year-old want to do this?
Well, Andy, they want to chew, they want to smile, they want to have a nice smile like yours.
Okay.
They want to be able to chew their food properly. They want to be able to celebrate with their kids. You know, when you're 80 years old, you have people visiting you during the holidays. You know, they bring you food. They want to be able to eat their food with their family. This is a big thing for them. And for them, if they can't do this, it's bad.
So if you're like 80 or 90, they're not more likely to fall out? Statistically?
No,
really?
Actually,
okay.
I do it all the time, and actually for 80 years old, it's very predictable. Randy.
So they're young. At 80 is not.
Yeah.
But do they tell you that I'm too old, doctor, to get this done?
I do get this all the time. People comes in to me and they diagnose themselves. They tell me, "Oh, I have been wearing denture for 30 years. The other dentist told me I can't do it. Do you think you could do it for me?" I don't think you could do it for me.
Well, I've been told too. I think I told you this in the green room. If you've been wearing a denture for 10, 15 years, you can't do this. You don't have enough bone. You say that's not true.
No, not true. Because when these people come from other dentists, maybe they're looking at what the other dentists experience in this field, about their imaging. We have new technology, new implant building material that I could really literally take somebody in the morning and they'll be done in the afternoon with full set of teeth.
Upper and lower teeth.
Upper and lower teeth.
And so, I mean, we were talking about, you have a very busy practice. You're doing like more dental implant surgeries in a week than most guys do in a year.
I do.
Than many guys do in a year.
I do.
Okay. Is that because just your setup, because it's all done right there?
I do. We have the nice thing about this, Randy, and I'll have to tell you this. We have a setup where we have everything in one place. We have the digital imaging in one place. We plan the case in the office with the software, and we have like a picture of what we're gonna do for this patient, for this particular patient. It's either a female or a male. We design their teeth and we show it to them.
So they get to see it on a computer what it may look like ahead of time. Okay. They don't do that all the time. Is that correct?
No.
So that's an unusual thing. Do they ever look at it and say, I want that?
Yeah, they do. They actually bring me sometimes picture of their 20s and 30s. And there is a lady who came in last week and she told me, I want the teeth to be like this. She showed me a picture of like when she was 30 years old. She's already 70 years old. And believe it or not, I did it for her.
Okay.
I did it with the technician, with the right software. I designed the teeth that really made her look like 20 years old.
Good. So in New York, you said there's like, you could fill up a sports stadium with how many people have dentures.
Yeah.
If it's so good, why aren't they all doing it? Like, what's your take?
Well, Randy, there is a couple of reasons for that. One reason is that people with denture, they're out of the system. They don't go to the dentist anymore.
Okay.
So when you're out of the system, you live with this denture for 5, 6, 7 years, and the only time that you're going to go to the dentist is when you have pain because you have a sore spot in your mouth because the denture is loose or moving.
Okay.
So you go to the dentist, you hate being there, you don't like the appointment, you complain about the price of the reline, and then they do a reline for you fast and they send you home. Nobody ever tell you what's your option.
Which is to get those dentures fixed in there, supported by implants.
So to answer your question,
okay.
Nobody ever tell them their option. They're not being informed about what they could do with this. Another reason for this is that, let me put you in a perspective. I'm going to tell you the life of these people before they got into a denture. Okay. If you are a denture wearer, you probably went to the dentist over the periods of 20 or 30 years, more than 40 times, where you had loose teeth, you did root canal, you had failed root canal done, you have loose teeth, flaring teeth, and then you tried your best, a countless visit of x-rays, of patching work, and at one point they told you in the other office, oh, we can't help you anymore, you have to go into a denture. So for these people, they are relieved because they're done. They don't have to go to the dentist anymore.
That's a good point. Okay. So the last thing they want to do is see you.
Yeah.
Right? They're afraid of the dentist. Mm-hmm. And rightly so.
Yeah. And for these people, I could give them full set of teeth, upper and lower, in one day. The third reason is expenses, because they look at their teeth and they see they're missing a lot of teeth, and they think that they need one implant for each tooth. And they go to me, this is very expensive, I can't afford this treatment.
As far as cost, because we get emails about this. So even the best dental insurance doesn't really cover dental implants.
No.
Medicare, Medicaid doesn't really cover it.
They don't.
But you say people finance this.
Yeah. We have a third-party financing where we could literally help everyone who's looking to do this procedure.
Do people finance it?
They do.
I mean, it's common?
All the time, yeah.
Okay. I mean, you're not carrying it yourself. You're going through an outside lender.
Yeah.
Is that right?
Yeah.
Okay. So you brought some photos of the patients. Show me, what are we looking at there?
Here's this one.
Okay.
There's a patient who came to me. She was complaining about not being able to chew her food normally. She was like embarrassed from going out with her friends because she has a loose denture. And
I mean, she's showing no teeth there.
She
in the
has
smile.
no teeth, yeah.
Okay.
So she came to me and she wouldn't believe, like she didn't know what to ask me. She didn't know what I could do for her. And I told her I could give you teeth. I could give you teeth that you could go out with your friends, order whatever you want. You could eat on this salad or cucumber or steaks, whatever you want to eat. She was like, she wouldn't like believe that I could do this stuff for her.
Like skeptical.
She was very skeptical.
Okay.
And after we finished, you know what happened with her, Randy? This is really funny that she was in the beginning interested in chewing and she wanna eat her food properly, and then she started changing. She's like, she likes her smile. There's something that's like, she went out with her friends and they start complimenting her about her teeth, and this has really changed her. She's become more engaging, more happy.
So you gave her upper and lower teeth that don't come in and out,
full set of
supported
teeth,
by, let me see the after. Oh, it's very nice. Oh, wow.
Look at this, Randy.
Yeah.
Look at the before and after. What do you think? Doesn't she look more happy? Does she look more outgoing?
She looks more attractive as well.
That's what a smile does.
Makes you more attractive.
Makes you more attractive.
Looks a little younger too. More sophisticated. Now, this is all designed right there.
Yeah.
And they can eat right away. You just tell them to be, what, soft diet a little bit at the beginning?
In the beginning, maybe the first week, soft diet. Actually, after like a month or so, they start calling the office and they asked me, Doc, can I eat carrot? Can I bite on an apple? I tell them, yeah, you really eat whatever you want.
I mean, the front, like they could use their front teeth and bite a raw carrot?
Yeah.
Really?
That's what they do. They ask me, they're like, are you sure we could eat this? I'm really worried, like, is it gonna succeed? Is like implant gonna get damaged? No, you could do whatever you want.
You know, we were joking in the green room and we were talking about that the most expensive part about the procedure is going out to eat all the time. Because, you know, New York is known for the food.
Yeah. So I have people who, like, after they finish their surgery, 1 week after, they go out. They want to go out with their friend. They're missing so much before that they missed so much time not going out with their family and with their friends. They hold themselves back. They just hide home. They make excuses. And now they're going out and they spend on their food and they want to go out shopping. And it's amazing, Randy.
You know, on your website, I mean, you have videos of patients bragging about how great it is. Right? In fact, one patient said, if you have a problem, this is what the patient said, call me.
Yeah.
It was funny. It was very, very funny.
She's very funny lady, yeah.
So what are the options for a denture? Like if there's two groups of people. They have really bad teeth, bleeding gums, bad breath, like you said. Bad teeth, but you can't save them. Or the denturers. When they walk in and you meet them, what are their options when it comes to dental implants?
So what I do is that I check, during the consultation, I see what they're looking for. There is two type of option that we could give for these people. We could give them a full set of teeth, like your teeth. Fixed, attached to the implant, doesn't come out, and they could use it with their own teeth.
Okay.
And the other option is some people want to go like in a different route where we could give them some set of teeth that snaps in and snaps out. It's stable without the adhesive like the denture.
And you say you don't really like those because it's very popular now, these snap-in teeth. How come you don't like them?
I don't like them because the patient don't like them. A lot of patient that comes into my office from other places and they told me, I don't want to do this. I want to do the full set of teeth, the permanent attached one.
But isn't it true? I mean, again, I'm going to go back to this bone thing because I did that if you're limited on your bone because of your age, you're kind of forced to just do the snap in, snap out. That's not true?
That's not true.
Okay.
That's not true. I do it all the time because the technology that's available right now, I could build up your bone. I could make I could find a place like with the imaging. I only need 4 spots, and I will make you use that 4 spot to make you implant that could support this denture, this teeth.
Okay, good. Let's take a look at another photo.
I want you to take a look at this lady. The first visit that she come to our office, she was crying. She came with her daughter, and she told me, I want to change my life. I've been through a lot in my life, and I had a lot of problems, but I wanted to do something for myself now. I'm ready. My daughter is pushing me to do it, and I want to change my life.
Now that looks pretty bad. Is that unusual?
No, it's not
For you?
unusual because they manage to hide their smile. They manage to hide their teeth all the time.
So they don't smile.
They don't smile.
And you say
They hold
sometimes the
back.
patients will come in and say, Doc, this is the worst I bet you've ever seen.
All the time. They always tell me this. All my patients.
Because they don't see it either. Like, you know, because I never see teeth like this.
It's you know, Randy, what they do is they always manage to hide their teeth. People who have loose teeth or denture or an embarrass of themselves, they hold themselves back. It's like part of life. If you're not happy with your nose, if you're not happy with your smile,
Okay.
if something is bothering you when you smile, you hold back. You get less engaged with people.
Okay.
So when you go to for a party or a occasion, you manage, and they do it perfectly. They manage to hide those things.
Can
In
you
fact,
spot them? Like, can you tell when somebody's hiding their teeth?
you could always do that, Randy, because they hide. They be on the side. They don't want to show. They don't want to interact with people. They don't want to talk to people. They run away from this situation.
Now, I interrupted you. You were telling me the story about this woman. So she comes in with her daughter. And what's that like? Like, what happened? You said she was crying.
She was crying. She went through a lot of her life. She had a lot of problem, and she wanted, like, her daughter pushed her to do this.
Okay.
We gave her upper and lower teeth that don't come out. Wait till you see the final.
Let's take a look. Oh, gee, I wish they could see the upper part of her face. I mean, this is a complete, like an extreme makeover. I'm not trying to side with you. Anybody looking at this.
This
sees
lady, when I gave her the teeth, she held the mirror. She almost choked up. She was crying. She told me, she never seen herself this beautiful before. She told me, well, I guess this is the first day for the rest of. This is the first thing for the rest of my life.
Like the first day of the rest of her life.
The rest.
So this is, I mean, she's definitely prettier. And the teeth, like you said, you custom make it for the mouths.
Look at the after picture. Look
Okay.
at her smile. Look how the teeth follow the lip line. Look how the canine and the front teeth are feminine. They're rounded. They match her feminine personality. She looked radiant. When we finished this, she was jumping, Randy. She was jumping in the chair. She was jumping outside. She went outside to the waiting area, and she told everybody, "Look what he did to me. I want
She
you all
went to
guys."
your patients they were in the waiting room.
She was singing and jumping, and she went and she told everyone, "Please do your teeth. Look at what this. Look at my life. How
That's
it's changed
nice.
because of this. It's life changing."
You say that the patients will tell you, you changed my life.
Yeah, they do all the time, and this is what's satisfying. It makes me love what I do, Randy, because when I saw the smile on her face, when I saw her like happy, it gives satisfaction to my job, to the way that when I go and I study and all these hours and when all this work that I do, this what makes me happy at the end.
Because you've been doing dentistry for a long time.
For 20 years.
Is this the happiest group of patients? More than a cosmetic? Well, this is like cosmetic dentistry.
Cosmetic.
But is this the happiest group of people?
I think it's life-changing for them because these people that were hiding, they're hiding it from everywhere, from everyone. They're hiding from their own family, from their own spouses, and now...
Is it? You told me this, that some people that are married, the wife or the husband, they claim their spouse doesn't even know they have a denture.
Yeah.
Is that true?
They don't...
How do you hide something like that?
Randy, they find the perfect time when their spouses are not there just to clean their denture, just to they make it perfect for them, for the other partner not to see them with denture, without denture.
You say people with bad teeth are judged.
All the time. When you have bad teeth, look at the Hollywood, Randy.
Okay.
If you are the villain, they always make your smile gray in color. They make you, they want to make you look dumb, they take out a front tooth.
That's Even at Halloween, they come with a blacked out tooth. Okay.
Yeah. It's people are just, they always, when you go and you have a nice smile, people want to talk to you because of your inner peace, inner charisma that's coming out.
The charisma comes out
Because you're happy. When you don't have teeth, when you're missing teeth, you tend to be on the side. You don't want to engage. You don't want to show you don't want to show your full potential.
You said when they get it all done, they get their new upper and lower teeth, right? That they come back, you don't even recognize them sometimes. What do you mean by that?
I had a patient when the first time, she was hiding her smile, her hair wasn't done, and she looked like very depressed and upset. After we did her teeth, 6 months down the road, she came back for just like a maintenance, and she looks like a different person. Her hair is done. She's smiling. She's talking to everybody. She's like talking to the front desk, to the assistant. It was a complete change. It's not normal.
We're going to take a quick break. We come back, more about the process, like what they can expect on day one. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
I know a lot of people are afraid of the dentist, but it is never too late to take care of yourself. Your mouth is a very important part of yourself, and to have your mouth smelling clean, looking bright, it gives you so much self-confidence. So all of those that are afraid of the doctor, come see Moise, Dr. Moise. He is great at making you comfortable and making you smile beautiful.
You gotta come to Dr. Nawlo to get your smile corrected, okay? As a business owner, not even just as a business owner, period. You need to go get your smile corrected. If you feel like you don't like your smile, you have to come here and see Dr. Nawlo. Look at this smile, y'all. Do you see this? And guess what? I sound just perfectly fine. Do you see what you can get? Invest in yourself, invest in your smile. That's the first thing, anything you do. You greet everybody with your smile. Make sure you smile.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he is Brooklyn's go-to implant dentist. And he says he can give somebody brand new set of teeth in just one day. We have Dr. Nawlo. Dr. Nawlo. So as a recap for people just tuning in. So somebody, let's say they're wearing a denture. They can walk in on the day of the procedure, no teeth, and walk out with upper and lower teeth that don't come out.
Yes.
That's true.
We do it all the time.
All the time. It happens all the time.
In our office, we do it all the time.
And they could eat right away?
I mean, Randy, like 2 hours
Soft
after.
food.
Soft food the first day, but I have some patient who I finish the surgery in the morning. You know, they come at 9 o'clock, we finish around 12, and I call them to check on them at 3 or 4 o'clock in the afternoon, and they're out eating. I mean, everybody is different.
So you have to tell them, take it easy.
I do sometimes, yeah. The first week is the most important, and then after that, they could eat whatever they want.
What do they like more? Because I looked at these photos and you know they look good. I'm not trying to side with you here, but do they like the smile more, or do they like what they could eat more?
Well, I get two kind of patient, and this is what I wanted to speak with you about. Some patients come to me and they care about the smile. They want to smile for their wedding, for their son's wedding that's coming out, or they want to feel better about themselves. You know, when they go out with their friends. And I get other people that they want to be able to chew food. They want to eat more better. They can't eat with their denture. You know,
like
denture,
salads are tough.
Yeah, with denture you can just drop the food. They want to eat salad. They want to eat lettuce, they want to eat cucumber, they want to eat steak. I have a lady who came with her husband. She told me, it bothers me that I go out with him and I see his face. He wanted to eat steak and he can't, and he hide it. Now I want you to do this for him. Can you do this? Can you make him eat steak? And I told her, yes, we could.
Okay.
And that day when we did the surgery for him, I made sure I booked, but not that same day, like 2-3 days after, I booked for him a reservation in a steak, and I want to tell her, you
at
go
a
with him.
steakhouse.
Yeah, you make sure you eat with him the steak. She was happy. His face light up, like he was. It's amazing.
And the maintenance is just like having your own teeth. Like every 6 months or once a year, they just come in and you clean them.
I like for my patient to come every 6 months, just to take a look, check their bite, check everything is okay, and do my maintenance and send them home.
Do you ever disinfect? Because I know you get this laser. Do you ever disinfect, kill the bad bugs with the laser on some of these patients?
I do all the time. You know, when I told you in the beginning, when I get patients that I see that they come to me with loose teeth and they think they're hopeless, they wanted to take them out. Other dentists told them, oh, there's no other way, you have to take them out. So when I check them and I see they have they have a chance, I do it. I do the laser treatment for them, and
so you could save teeth as well.
I save them. I like to save teeth, because if I do, I will save them money and I will save their teeth, and it feels like it's satisfying for me just to be able to save some people's teeth instead of taking them out. So I try my best. If I can't, I have an option.
I got to ask you about pain. Like, it seems painful.
Well, during the procedures, there is no pain. I have a medical anesthesiologist that put them to
So a medical doctor is
watch-
doing the anesthesia.
Yeah, he watched their sign, the
Like
vital
IV
sign.
sedation?
We have IV sedation in the office. So I have somebody who would do the sedation for them, where I could concentrate on the surgery. I don't do, there are other offices they do the sedation and the surgery, but I like to concentrate in my field, and I like to have them sedated in a very safe way with the anesthesiologist doing his job.
Yeah, but some doctors, and I've had them on the program, they just give them a pill rather than IV sedation. What are your thoughts on that?
I like IV sedation more because I could control when I could take them out of the sedation. With the pills, sometimes you cannot control when you could take them out and in. With IV sedation, I'm in control. So if, let's say, I finish the surgery right now, I could just in 5 minutes they're out. In pills, you can't do that.
Is it mostly word of mouth? I mean, I know Google. You're all over the place on Google, but is this the kind of thing where they tell their friends?
I care about word of mouth because I get, out of good, satisfying customer, I get a lot of people. Because patients, when they're happy, they go outside and they talk to, they tell everyone. They tell their family, they tell their friends. I have an old lady, she comes in and she sent me 20 patients. She told all her friends. She was so excited that she kept telling everyone. And every time she sent me a patient, she called me and she told me, I send you my friend. Take care of her.
Because there's over 100,000 people where you are wearing an upper lower denture. You were saying, if they all knew how good this was to get teeth that don't come in and out, there's not even enough dentists to help them.
No.
Is that right?
Yeah, we're going to be in shortage of dentists because there's so many people that we could that they have the denture and they need to do the procedure.
All right, so no more dentures.
No more denture
in your hands. Well, and experience matters.
Yeah, definitely.
I mean, you've been doing this for how many years? Have you been in and around dental implants?
Almost 20 years.
20 years. Well, good for you. And it's just getting better. I mean, now you pre-do the surgery on a computer.
Yeah. So we plan the surgery. We do everything in the computer. We have the guided surgery. So I make sure that when I study the case, I make sure the implants are going in the correct position, where I have enough bone, where I avoid all those structures that are very sensitive. And we literally do the surgery before we do it.
Final message: somebody watching this, they have really bad teeth and gums, or the other group are their denture wearers. But let's say they've heard what you had to say, but they're skeptical. They're going, I don't know. What do you say to them?
Don't be afraid. There is a hope at the end, because you don't have to go to the restaurant and order whatever your teeth could chew. Don't hold yourself. You go out if you want to date somebody. Don't have this little secret that you're gonna hide your denture from them when they go with you home. There is a hope out there. You could change your life.
Is it a free consultation?
All the time.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you so much, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.